Good afternoon, Atlanta. You're listening to WGE Network, Veterans Today. I am Herman Anderson, one of the co-hosts. My uh, partner, Anthony C. Aiken, is not available. Not available today, so I will be doing the show, and I will be working with our guest, which is Dr. Joyce. After I go through our uh, initial program information, I will introduce Dr. Joyce. As I say, this is WGERadio.com. We are the worldwide community empowerment group. Uh, you can like us on Facebook, follow us on Twitter, and there are several ways we are streaming live today. We're streaming live on YouTube, Facebook, Twitter, uh, uh, Instagram, and you can also go to WCEGradio.com and WCETalkRadio.com. You can go to hashtag Veteran Helping Veterans, hashtag Veterans Today. So we are on, and we also, let me state, we are a nonprofit. We would gladly accept donations, and our business office number is 404-490-8646. And the disclaimer is the topics and opinion are those of the show hosts and guests, not WCEG Network. And as I said earlier, I am Herman Anderson. My co-host Anthony Aiken is not available today. My guest is Dr. Joyce, and I'm going to read her bio, and after that, Dr. Joyce will give you additional information about her specialty and the amount of work she does with veterans. Today's guest is Dr. Joyce, a medical doctor, physician specialist in internal medicine. She also has a master's degree in public health and associate professor of medicine. Dr. Joyce is a Maxwell certified coach, mentor, trainer, and speaker. She coaches people with chronic illness to help them live their best life. Despite a chronic illness, she provides relevant medical and mindset tips on how to flourish despite a chronic illness, such as diabetes, heart disease, cancer, problems sleeping, stress, overweight, obesity, high blood pressure, and many more clinic illnesses. Dr. Joyce provides short videos with both medical and mindset tips on to flourish with chronic illness. She's also a public speaker on matters related to chronic medical conditions. Additionally, Dr. Joyce coaches people with new diagnosis of chronic illness, how to best manage these illnesses and live a fulfilled life despite the chronic illness. She's founder of Flourishing Health, flourish.com, flourishdr.com, and the Flourishing Health community, where she provides daily medical mindset tips to people with chronic illness, flourishing despite illness. Your health is her priority. Dr. Joyce also provides education tips for caretakers of people with chronic illness on how to best help their patients and how to flourish doing so. Dr. Joyce is on live. In addition to what I just read you, she informed me that she works with a lot of veterans, and that just fits right in what we talk about on Veterans Today. So, Dr. Joyce, will you give us a little bit of additional information, then we'll move into our program.
Yes, thank you very much for this opportunity. I am an associate professor with one of our main universities here in the Atlanta area. I have worked and I continue to work with veterans for the past 12 years. I work with veterans in the inpatient medicine setting, and I work with them even in the outpatient medical settings. So I have a lot of experience with veterans, and we will be talking about post-traumatic stress disorder today. And additionally, we'll talk very briefly about managing crises or suicidal ideations. So.
Okay, so let's get started. PTSD is really a high-profile topic with veterans, but also, in addition to veterans, just the general population of PTSD is an issue. It has risen. It has lately more in the general population, but it's been with. I'm a Vietnam veteran, so it's been with us veterans all along. It was even before it was named PTSD. It was called something else. So let's get started. What? Go ahead.
I said, all right, thank you very much. And just to add on with Vietnam War veterans, PTSD was even more because of how controversial the war was and how the veterans were received when they came back home. So that is a population where we have a little bit more PTSD. But I guess the question is, what is PTSD? So what is post-traumatic stress disorder? So post-traumatic stress disorder is a mental health condition that develops after you go through or see a life-threatening event. So it's something which you either experience or you witnessed. Symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. Most people who go through traumatic events may have temporary difficulties adjusting and coping, but with time and good self-care, they usually get better. You might have PTSD though, if the symptoms last longer than 4 weeks, if they cause you great distress, if they interfere with your work or home life, or if they interfere with your day-to-day functioning. PTSD symptoms may start later or may come and go over time for some people. So you don't necessarily have the symptoms of PTSD right after the event. Some people have it right after the event, but some other people start experiencing the symptoms later on, at times even months or years later.
Can I stop you?
Yes, sir.
Not to interrupt your flow, but particularly with veterans, it's the later ring a bell with veterans because when you in service and when you in active duty, you in the war zone, you're not aware of the issue. And for example, Vietnam veterans, I spent 4 years in the Air Force. Once I got out of the Air Force, I went to college and did something else, and I didn't even know what the word PTSD meant. So, but it kicks in later. So that's so now that's I just wanted to ask you how that fits in with the flow of what you're talking about.
That is correct. You know, most of our veterans, when they are in the action, they really don't realize what is going on, or they don't pay attention to what is going on. They are just there to get their job done. But then when they return home and they have the time to be with themselves, they start kind of like remembering things, and you know, PTSD at times sets in at that point, which is far away from when they had the experience. So that is something we observe a lot in our veterans. Practically anyone can develop PTSD at any age. Some of the factors can increase the chance of someone developing PTSD, many of which are not under the person's control. There are factors which are just completely not under your control that can cause you to develop PTSD. PTSD is also more common after certain types of trauma, like combat. And just as we said earlier, it may not be right away. You may come back from the combat before you start having the signs of PTSD. Also, things like sexual assault are very high on the list of things that cause PTSD. We do have some personal factors that can cause people to have PTSD, such as previous traumatic exposures, the age at which they have these exposures, and the gender. All of this can affect whether or not a person would develop PTSD. What happens after the traumatic event is also important. Stress can make PTSD more likely, while social support can make it less likely. And this explains why we really want to make sure that our veterans are very fully supported socially, so as to reduce the risk of them having post-traumatic stress disorder. If you come back from combat and you don't have any social cycle, you don't have any support, you're more likely to develop post-traumatic stress disorder.
Well, on that point is particularly with veterans in the VA system, a lot of time, number one, veterans does not even enroll in the VA system. And number two, I don't think society makes available enough information about mental health and PTSD to allow veterans and people that are suffering with PTSD to know that it's okay to seek help. What are your thoughts on that?
That is absolutely true. And that is why a program like yours is very important, to inform people of the fact that there is help available even in the communities. But at the VA, we have a National Center for PTSD, which has a large amount of information. It has a large amount of resources to get there and really be able to have the support that you need for PTSD. And just as we, go ahead, sir.
Yeah, well, okay. I don't want to push on the VA too hard. So the National Center at the VA, a lot of us don't know it exists. We don't know how to get to it. So could you provide, if not on air, me some information that I could get to veterans about the resources for the National Center?
Yes, I can absolutely do that. I'll provide you with the website, and we have a lot of resources. When we get to the treatment, they have like coaches, they have like virtual coaches on those websites where you can, if you have PTSD, you can get different types of treatment or information that can help you and how to get to treatment. So we will talk about that once we get to the treatments. But one thing I promise is I will make sure that I leave the websites and the informations on this website so that everyone can have access to anytime they want that information.
Thank you.
All righty. So these symptoms can cause significant problems. The symptoms of post-traumatic stress disorder, PTSD, can cause significant problems in social situations or work situations, and even in your relationships. So once you have the symptoms of PTSD, it's very important to recognize that something is not right and seek the appropriate help. And just as we mentioned, we have the National Center for PTSD. We also have a crisis help number, which I will give you that number, and I have it, I'll give you guys in a short while. So they can also interfere with your ability to go about your normal daily task. There are people who just cannot function because of PTSD. They can't even get out of their homes. They're just afraid to even go to the store because there are things that they see or smell or hear that remind them of what happened, and they're unable to function in those situations. So these are things that we all need to have in mind, and so that we can be able to help anyone who has PTSD. And also, people who have PTSD should be able to seek help when they have any of these symptoms. The PTSD symptoms are generally grouped into 4 different types. You have intrusive memories or reliving the event. You have avoidance, you have negative changes in thinking and mood, and you have changes in physical and emotional reactions. And we will go through each of these symptoms, how they manifest. These symptoms can vary over time or can vary from one person to the other. So people with PTSD do manifest differently. So people who manifest mainly with intrusive memories usually have recurrent, unwanted, distressing memories of the traumatic event, reliving the event as if it were happening again. So they do have flashbacks of that event and they keep reliving the same event over and over and over. At times, they do have upsetting dreams or nightmares about the traumatic event, and severe emotional distress or physical reactions to something that reminds them of the traumatic event. For example, they see or hear or smell something that causes them to relive the event. So if, for example, someone had like a motor vehicle accident and there was a fruit tree close to that area where the accident occurred, when they see that type of tree, they remember the accident. Or when they see something that was at the accident site, even though it had nothing to do with the accident, they relive that accident. So you cannot really, people don't know what is going to trigger them. But the people who have PTSD, once they pay attention, they may be able to recognize the things that will cause them to have a trigger of the PTSD. Another group of persons with PTSD usually manifests this through avoidance. Yes, go ahead.
The thing you mentioned, the things that trigger it, and you also mentioned treatment. So is that treatment to help the patient identify what is triggering this, and so when you are in that situation, you would be on the lookout for it. Is that correct?
Yes, we have treatments that will help you identify the triggers if you've not already identified them by yourself. So, and we'll talk about that briefly during this discussion that we're having today. So, okay. All right. So the second group of people who with PTSD can manifest things through avoidance. They avoid things that remind them of the event. Symptoms of people who have avoidance may include trying to avoid thinking or talking about the traumatic event. They avoid places, activities, or people that remind them of that traumatic event. They may even avoid driving if they were in a car accident or in a military convoy that was bombarded. After that, they just avoid driving totally. So they avoid anything that will bring them back to that event or that will remind them of the event. Then we have a third type of clinical manifestation. So some people may just manifest post-traumatic stress disorder, PTSD, through negative changes in thinking and mood. So they have more negative thoughts and feelings than before the event occurred. The way you think about yourself may change, and others may become more negative because of the trauma. People who you used to really think of them as great, terrific people, you may start thinking a lot of negative things about them and thinking they are not that great after all, after you have trauma and after you have after you've developed PTSD. And negative thoughts about the world is something, these are very pessimistic. They think everything is negative, and that kind of like should be a warning sign of the fact that they may have PTSD. They become hopeless about the future. They have memory problems, including not remembering important aspects of the traumatic event. They have difficulties maintaining close relationships. They have a feeling of detachment from family and friends. They just detach from their families. They don't want to have anything to do with anyone. And that is common at times amongst the patients we see. They'll tell you, don't talk to my family member, don't call any person. Even if you see that they do need that help, they need some external support from family. And what happens with people who usually end up in this having negative changes in thinking and mood is that they lack interest in activities which they once enjoyed. Someone who used to enjoy maybe going to a football match does not even want to hear about football anymore, does not watch football at all. So these are some of the things that could happen due to PTSD. They may have difficulties experiencing any positive emotions. Negative emotions, yes, they're good and strong and active, but they don't, positive emotions, they're just completely numb to those. And it's common for them to just generally feel very emotionally numb. And then the last type of changes that we see is changes in physical and emotional reactions. So you see someone who has PTSD, and after the traumatic event occurred, they start feeling on the edge or keyed up. And this is also called hyperarousal. The least thing, they go off. The least thing, they feel kind of irritated. You know, they may be jittery or always alert, on the lookout for danger. They're always looking out, what is wrong? Is something going wrong? What is that? Always suspicious about everything around them. They're easily startled or frightened. You know, someone, if a grandchild comes into the room and say, whoop, you jump up, you fall. It's some very just frightened by anything. They're always being on the guard for danger. They have a self-destructive behavior, such as drinking too much or driving too fast. When people have these changes in physical and emotional reactions, they may have trouble sleeping or trouble concentrating. They're irritable. They have anger outbursts or aggressive behaviors. They usually have overwhelming guilt or shame. But it's very important to remember that when you start having the symptoms, you want to think of them. You want to remind yourself that you may have post-traumatic stress disorder. Of importance, something we really need to have in mind is that children may also have post-traumatic stress disorder. Children under 6 may get upset if their parents are not close by them. They may have trouble sleeping or act out of trauma in their play. If the children are between the ages of 7 to 11, they may also act out the trauma through play, drawings, or stories. They have drawings which you look at the drawings and it has something to do with the trauma that they witnessed. Some of these children have nightmares or become more irritable or aggressive. They may also want to avoid school or have trouble with schoolwork or friends. But once the children have gotten to the age of 12 and they're older than 12 years old, they usually react like in a manner that is very similar to adults. So they can develop depression, anxiety, they can become very withdrawn, or they have reckless behaviors like substance abuse or running away from home. When you see these things, and especially if they start going on for more than 4 weeks, then you want to pay attention and seek help. You know, once we have major trauma, you know, we can have some certain types of behaviors. You can feel irritable, you can lack sleep, you can feel sad. But once this persists and is getting to above 4 weeks, if this goes on for months, then you should be worried that this may be post-traumatic stress disorder. And post-traumatic stress disorder symptoms can vary in intensity over time. You may have more PTSD symptoms when you are stressed in general, or when you come across reminders of what you went through.
Let me ask the children portion of it. What are some examples of trauma that causes them to have PTSD?
For children?
Yes.
Let's say a child noticed his parent being killed. That can cause that child to have PTSD.
Okay.
That is a life-threatening thing to the child, or that they witnessed or they saw. So those are some of the things we really need to pay attention to.
So would it be correct to say that some of the activities going on in our schools today could cause PTSD to kids that are in elementary and high school?
Most definitely. Most definitely. just seeing their colleagues being killed, their classmates being killed, or someone having a gun and almost killing them, that is something that can cause PTSD. And that is something which we as adults need to pay close attention to and make sure that these children have the help that they need so that they can get out of this. The very, very important thing I want to really point out is that PTSD can be treated. PTSD is something which has treatment. It has treatments that have been proven to work. So once we have any person who has PTSD, we should seek medical help. And so I will take from here, let's address when to see a doctor. So if you have disturbing thoughts and feelings about a traumatic event or for more than a month, if these thoughts or feelings are very severe, or if you feel like you're having trouble getting your life back under control, talk to your doctor or a mental health professional. Most of the community doctors, so if you're not a veteran, you talk to your doctor, they do have a network that they know how to reach out to so that they can get you someone who is specialized in this type of care to help you. Or if you're with the VA, then you talk with your mental health professional, or even your primary care doctor can refer you for mental health care with a professional, a mental health professional that knows how to manage PTSD.
Let me make a comment about the VA system. I think because those of us veterans that in the system, and we've been doing this program for, so I think 7 years now. So I definitely recommend that you start with your primary care doctor. And there are some veterans that don't even know who their primary care doctor or their social worker is because they just haven't inquired about it and got the information. But yes, I recommend that veterans start with their primary care doctor because your primary care doctor will get you to your social worker and the specialist that you need. In the Metro Atlanta area and in the VA system, you have, for example, in Atlanta, you have the regional out there on Claremont, but you also have community clinics in. So I would say VA veterans need more information and guidance on how to navigate the system.
Yes, and so one of the things you can do is actually call the crisis center. The crisis center does have specialists who can tell you how to navigate this, what you need to do next, who you can get. They can actually get in touch with someone who can help you. And the VA crisis center, I'll just say it now, but I'll make sure that we have it also in writing. The number is 1-800-273-8255. If you are a veteran, you press 1. Or if you are a family member of a veteran, or you are a service member or family member of a service person, you press 1. So I want to repeat that number: 1-800-273-8255, and then you press 1. Some of the important things to know is that you can also text this number, and the number you text is that you send a text to 828255. That's the number you send the text to. So the number again is 828255 if you need to send a text.
Well, thank you. That's information that I normally give out. Now I don't have to. Today you already did it. Thank you.
So that is some of the information that they need to get. And once you call the crisis center, you'll get someone who can direct you on what to do next. And make sure that before you leave that phone, you know exactly what your next steps are so that you can get the help that you need. So I want to talk a little bit about the treatments that are available for PTSD. Generally, we have trauma-focused psychotherapy, and you've heard some things like counseling or talk therapy. You have medical therapy that has been proven to work for post-traumatic stress disorder, and you can get a combination of these therapies. So the question becomes, who gets what? The most recommended treatments are the trauma-focused psychotherapy, but the decision is a combined decision between you and your treatment team. They'll talk with you, give you all the positive, all the side effects and all the great things. And the side effects are very minimal for any of these therapies. They'll discuss with you and then you choose which one you want to go with. But it's something which is completely, again, you have to work together with your team. And the team helps you to make that decision based on your lifestyle and based on your preferences. So I talked about the trauma-focused psychotherapy. What does that mean? What is the meaning of trauma-focused psychotherapy? This just means that the treatment focuses on the memory of the traumatic event or its meaning. Trauma-focused psychotherapy are the most highly recommended treatment for PTSD. And the three most effective types of trauma-focused psychotherapy are cognitive processing therapy, which I'm sure you've heard CPT, where you learn skills to understand how trauma changed your thoughts and feelings. Changing how you think about the trauma can change how you feel. We have prolonged exposure, where you talk about your trauma repeatedly until memories are no longer upsetting. This will help you get some control over your thoughts and feelings about the trauma. You also go to places or do things that are safe, but that you have been staying away from because they remind you of the trauma. So once you have this exposure, prolonged exposure therapy, you're able to maybe the things that used to trigger you no longer trigger you. The places you were avoiding, you no longer avoid those places. And these therapies are very effective, and as we said, are evidence-based therapies. And the third type of trauma-focused psychotherapy is called eye movement desensitization and processing. It's EMDR. I'm sure some of you have heard of EMDR. And this involves focusing on sounds or hand movements while you talk about the trauma. This helps your brain work through the traumatic memories. And these are all done by people by psychologists or mental health specialists that are very versed with these treatments. And we have on the National Center for PTSD, we do have an app for cognitive processing therapy. It's called CPT Coach. And I will give you the website to get to that, to the National Center for PTSD. And we have another app for prolonged exposure. And these are things which you can kind of access and explore them a little bit. And another one for EMDR, which is the eye movement, this is desensitization processing. The apps is still being built at this point, but we have other resources such as from the Stanford University, and you can Google and get that. These apps I'm talking about, if you even Google them, or you can go maybe to your Apple apps or to the Google Play store, you can get these apps for free. And so you can kind of try to explore them, and they're very helpful. I would recommend for anyone to at least access them and see what they have to offer. So medications for PTSD, we do have medications. They are usually not the first choice, but we have several medications, and these are usually medications that are used for depression also. And we have several of them. I'm sure some of you have heard like Paxil, and you've heard of Effexor, and those are examples of some of the medications that we use to treat PTSD. Any questions?
Yeah, a lot of veterans are hesitant to take the medication because I've had that discussion with a lot of, particularly, well, I would start to say older veterans, but any veterans kind of hesitant to take the medication. So, what are your comment on that?
So that is, and that is why we do have non-medication treatments like the ones we talked about earlier, you know, like the trauma-focused psychotherapies, which we have different types. So yes, there are lots of, a lot of people may be hesitant to take medications, and that is fine. And that's why we said deciding what is best for you is something you talk with your medical team. And a lot of the fact that your preference plays a very big role in what treatments you decide to go with. So we talked about the trauma-focused psychotherapy, which includes things like cognitive processing therapy that has no medications involved. You have prolonged exposures, again, no medications involved, and even the eye movement desensitization and reprocessing, the EMDR. These three have no medications involved. So yes, so we have medications and non-medications, and you can kind of like choose what you want.
Okay. Concerning communication and resources in how to really for veterans to communicate with the VA system and to get accurate and timely information. I use my Healthy Vet. What are your thoughts on the best way? Because in the VA, there's a waiting system, and there's and sometimes that discourages people because when you get an appointment, it's so far out. So, what are your recommendations in order to really? I know you can't increase it, but as well as to be able to communicate with the VA and feel like you are somebody's listening to you.
Right. So I think with regards to PTSD particularly, contacting the crisis line is very important. And again, if you go to the PTSD website for the VA, which is, I'll give you the site, is www.ptsd.va.gov. And I think we'll put it on your website once we're done, just to make sure that we have it there. Again, www.ptsd.va.gov. Okay. If you contact them through this, someone will contact you back. Or if you call the crisis line, which we gave the number earlier, once you call that line, you should have someone who can help you right there and then, and make sure that you're clocked into the system. And if that does not happen, then you can kind of like call them back. But it's very important. The crisis line is much easier to get than at times your primary doctor, unfortunately. Yes.
So that would get you plugged into the system, and that from there, as far as making your appointment with your primary care doctor specialist is that has to be done through the system. And I mean, there are several ways you can do it. From my experience, you can do it by telephone, by calling the VA and the clinics. Also, technology-wise, you can use My Healthy Vet.
Correct.
Okay.
Yes. So just exactly what you're saying, that those are the best ways. You contact the crisis line, you contact you, and they can get you plugged into the system. You contact your primary doctor if you already have one. You contact them, and you can contact them in different ways. You can do My Healthy Vet, you can send them a message, you can call them. So there are different ways you can contact your primary doctor. And just in that light, whenever you go to your primary doctor, make sure that you have all the methods to contact your doctors, so that when you're in crisis, you know how to reach them.
That is very important.
Mm.
Thanks for that. Because it's what we try to do on this program is to help veterans and their family navigate the system, navigate the VA I mean, there if you're dealing with even not the VA, I mean, there are still in today's society a lot of issues because the way we have technology-wise, it's whether you're dealing with the VA or whether you're dealing with the medical issue, it's hard to talk to a person now. You get recorded, you get canned messages and all of that. So there's nothing you can do about it, but I'm just voicing my opinion.
I hear you, really.
Okay. So PTSD. And any other subject you want to bring up today? We'll do that at a later time.
Yeah. So I can talk about maybe just really the important things. If you have any suicidal thoughts, what should you do? Right?
Okay.
If you have thoughts of suicide. So if you or someone you know has suicidal thoughts, get help right away through one or more of these resources. Reach out to a close friend or loved one if you're having those type of thoughts. Contact your spiritual leader, your minister, or someone in your faith community. You know, these are people who are extremely helpful, and contact them if you're having suicidal thoughts. Call a suicide helpline number. And again, as we said, the number is, we have a National Suicide Prevention Lifeline, which happens to have the same number like the crisis line, is 1-800-273-TALK, which is 1-800-273-8255. And you will get, once you call this number, you'll get to a trained counselor. Use the same number and press 1 if you're a veteran, as we said earlier. Make an appointment with your doctor or a professional. That is another thing you can do if you're having suicide thoughts. Now, when should you get an emergency help? If you think you may hurt yourself or attempt suicide, call 911 or your local emergency number immediately. 911. If you feel like, oh my God, I'm going to hurt someone right now, or I'm going to hurt myself, call 911 right away. If you know someone who is in danger or of attempting a suicide or has made a suicide attempt, make sure someone stays with that person to keep them safe. Call 911 again. I just cannot, if you are really in an emergency situation, call 911 or your local emergency number. Or if you can do so safely, take the person to the nearest emergency room. So if someone has suicidal ideation, we have to act really fast. Our first level of help is 911. So
excuse me. So
yes.
The first level of help is 911. In the suicide prevention number, the VA number is also very important.
Yes.
At one time, the Atlanta VA had a program where it was pretty much 24 hours. I think that has been changed were you aware of the program that they had that where someone that was could actually walk into the VA and get treatment?
Yes, and we still have that program. So during COVID, that program was kind of stopped because people could not walk directly into the VA, but they still have the programs at this point, and they have support numbers which you can call or walk in clinics you can walk into.
Okay, can you get us those numbers, please?
I can
not now, but yeah.
Yes, I can get you that information.
Okay.
All right. So again, when you have crisis, when you're having all those stressors, you want to make sure that you already have plans as to what you can do. So for people who are at risk of suicide, when people are feeling hopeless or stuck, or when you're feeling hopeless or you're feeling stuck, you need to start getting help. When people are in crisis, they hardly know how to think at that point. Everybody, if you're stressed up, it's difficult to think. And generally, crisis hardly come from nowhere. You start getting warning signs. You start feeling like, I'm not feeling good, or this thing is getting me irritated, or you know that crises are coming. It's very important that when you are not in crisis, you know the baseline and your relatives know the baseline, so that when something is getting different, they know to act. So some things are hard stressors for people, such as a new medical diagnosis. You go to the hospital and you're told you have end-stage cancer. These are stressors. These are stressors which will be for almost every person. So when someone is in that situation, we need to make sure that we give them the support that they need. And as soon as we think that things are going downhill, we call the crisis line. And as we said, you can also chat or text the crisis line, which is the text. You can text at 828255. So the crisis line can be text. You can text or chat with them at 828255. Or you can call them directly again at 1-800-273-8255. 1-800-273-8255. And if you're a veteran, you press the number 1 because you get help from people who are very skilled with veterans. And one of the things is that you can get to a safe place or get a safety plan when you are not in crisis. Again, when you're already in crisis, your thinking is clouded, your thinking is distorted. But when you're in your good state, make sure that you have a good crisis plan that you can follow without thinking a lot. So for example, if you have like guns, make sure that they are well locked somewhere, or possibly not have them in the house. It just depends on your preferences, but it's important not to keep things that you can easily hurt yourself with around you. If you have excessive medications at home, try to keep them locked somewhere, or even avoid doing that, so that if you get into crisis, you don't have to deal with, you don't have easy access to something that you can hurt yourself with. And the important thing is that these lines do have Spanish and they have English. So even if you're a Spanish speaking person, you can kind of get across to these lines. So safety planning, and one of the things is that, safety planning is embedded in some of the PTSD apps, which I talked about earlier. If you click on those apps, and I'll send the links again, if you click on those apps, you can create a safety plan right there and then. You think about a safety plan when you're in your good state, or when you're not in crisis, and you create a safety plan so that when you're in crisis, you're good to go, you know what to do. And do not forget to reach out for help, ask for help, so.
Okay, well, that is true. When I go to my primary care doctor for my annual checkup, they go ask all of the questions. One of the questions they ask: have you thought about suicide? Which is good, but what I'm saying is, does the VA have a system built in if you identify yourself or if you identified? As I talk about it, in the person, you don't want to call the crisis line on your own. Is there any way in the VA for the VA to have someone contact this person and give them counseling, encourage them?
So if you're not in crisis and you feel like you're getting close to crisis, you can call and then someone can reach out to you. One of the important things I think you can do is also make sure that the crisis line or the numbers that you need are readily available for your family members to call, and your family members can well call. You can make sure that all your family members have the number that once they realize that you are already, you're not in your best state and you are in a state of crisis, they can call. So it's very important to make sure that they have these numbers, they have this information, and they can call the crisis line, and then they can actually ask the crisis line to reach you if you are in a situation of crisis that maybe they have been unable to get to you emotionally. And in that way, the crisis line reaching out to you will get to you. The person who will get to you is an expert who knows exactly how best to deal with that type of crisis. Your family members may not know how to deal with it.
That's true. Also, I'm vaguely familiar. Well, I'm with the PTSD the PTSD Resource Center, which I know they put out a monthly newsletter and they put out other information that is available to the family members of someone that's dealing with the issue. Is that correct?
That is correct. That is correct. And your family member can just call that line. They can call those numbers. It's not meant only for you. Because if you look at it realistically, when you are in a crisis, you may not even have the right mind to call. You might not even remember to call. You may just, and so your family members have to know how to help you. Because if you're at home, you're helpless and your family members are looking at you and they don't know what to do, they can call the helpline and the helpline can help you or can help them help you.
Okay, good. And I know since you work for the VA, and I know you're aware of the suicide prevention issues that the National VA has. Normally, they put out numbers that emphasize the number of suicide each month and all of that. So in the last 3 years, have you seen improvement in the suicide prevention efforts of the VA or the suicide prevention efforts of the entire nation?
So I will just start by putting a disclaimer that I am not speaking for the VA at this point. So, and I don't work with the group that puts out information about suicide or that works on suicide prevention. I'm not part of that core group. But what I know is that they have been putting out a lot of other things. There's been a lot of effort put into suicide prevention, but I may not be able to give you exactly what those efforts are.
Okay. So we, our time is winding up. In summary, what else would you like to add? Summarize. Let's do it.
So there are a few things that I would just like to say. For example, that PTSD is something that is treatable. Getting help is the most important thing you want to do. You see people's strength also in the fact that they're able to request for help when they need it. And we do have different types of treatment, medications and non-medications. Make sure you get help for PTSD. That is the most important point I want everyone to really take home. And again, for suicidal ideation, you make sure that you have a plan so that when you're in crisis situation, you know what to do, or your family members know what to do. That is where I will end. And if, there are different ways people can reach me. You can reach me through my Instagram, which is docjoyce3. And you can also reach me through my website, and we have ways to be able to contact me through the website. And again, is flourishdr, so flourishdoctor.com. So flourishdr for doctor.com. And thank you for this opportunity, Mr. Herman.
You are quite welcome, and you gave us a lot of good information, and thank you, and we will have you back. And so thank you, and we also will make sure that the information that you provided, that we put it on our website and our social media systems, and any additional information you would like to send me, you have my email and my phone number. Thank you very much for the program, and I will be following up with you.
Thank you very much. It's been my pleasure. Have a terrific day.
Thank you. And let our viewers know in closing, you're listening to WCEG We are a nonprofit. Our contact information is 404-490-8646. Our disclaimer is the topics and opinion are those of the show host and the guests, not WCEG Network. And to everyone, have a good afternoon, have a good Friday, and in 2 weeks, Anthony and myself will be back with another program of Veterans Today.